Okay, everybody, Dr. Rayford from Vet Triage. We are continuing on with this issue of JAVMA from June 1st, 2015. We are talking about nutrition today, the effect of question design on dietary information solicited during veterinarian-client interactions in companion animal practice in Ontario, Canada. And I will say right off the bat, not that I'm trying to be mean, there are some papers that you guys know who subscribe to this channel that I'm not a fan of, and it's for various reasons. And this is one that I'm not the biggest fan of. I think they're taking a topic that's fairly straightforward and could have been summarized a lot shorter with this maybe even a simpler study design, but it almost seems like this is the kind of paper that belongs in like another type of journal and not a veterinary journal. But anyway, that being said, we'll go through it because it does highlight the importance of speaking about nutrition with your veterinarian. The study comes out of the University of Guelph and the University of Calgary. All right. So the objective is to establish the types of initial questions used by veterinarians in companion animal practice to solicit nutritional history information from owners of dogs and cats, the dietary information elicited, and the relationship between initial question-answer sequences and later nutrition-related questions. The sample size were 98 appointments featuring 15 veterinarians, 284 videotaped veterinarian client patient visits involving 17 vets in companion animal practices in Eastern Ontario, Canada. The procedures veterinarian and client talked related to patient nutrition were identified and transcribed. Nutrition-related discussions occurred in 172 visits, 98 of which contained veterinary-initiated question-answer sequences about patient nutritional history, so 99 sequences in total, with 2 sequences in 1 visit. Results. The predominant question format used by veterinarians was a what prefaced question asking about the current content of the patient's diet. That was 75 out of 99, and you guys know that I don't like when they don't make that percentage. Overall, 63 appointments involved a single what preface question in the first turn of nutrition talk by the veterinarian, so 64 sequences in total, and then dietary information in client responses was typically restricted to the brand name, the subtype, or the brand name and subtype of a single food item. When additional diet questions were posed, they typically sought only clarification about the item previously mentioned by the client. Conclusions. Results suggest that question design can influence the accuracy and completeness of nutritional history. These findings can potentially provide important evidence-based guidance for communication training in nutritional assessment techniques. All right. Introduction. Previous researchers adapted methods used in human medical communication to analyze videotapes of veterinary client-patient interactions during clinic appointments and identify broad communication patterns along with the types of utterances, their proposed functions, and their relative frequencies. See, I mean, they're taking, again, this is fine, this is the way you have to do it, but they're taking something as simple as a conversation or a sentence structure and breaking it down to all these kind of more, computing or engineering type of formats, which is good and bad. A different approach, the qualitative methodology of conversation analysis, is better suited to such inquiry. Strongly empirical and inductive conversational analysis can be best understood in relation to its theoretical assumptions and aims, focusing on the study of real-life conversations and the social actions it achieves. Conversation analysis treats conversation as a deeply ordered and systematically and autonomously organized domain. Its foundation is the sequencing of different speakers' successive contributions to a conversation, with analysis of turn-taking at its core. One object of study in conversation analysis is the question-answer sequence, consisting at a minimum of a first speaker's question turn and a second speaker's response. Through close inspection of the interactional details of turns during talk, conversation analysis aims to document what the participants are doing with their talk, how they understand each other as these understandings are displayed in their talk. Analysis of the sequential environment with what precedes a certain turn, like a question preceding an answer, and what comes after that turn is critical for illuminating what understandings and actions. So, question of, is there something else you want to address in the visit today? This is in other studies. there was significantly fewer pre-visit patient concerns that remained unmet by the end of a visit compared with the number of unmet concerns when a patient was asked, "Is there anything else you want to address in the visit today?" These findings suggest that patient responses are often designed to meet the expectations set by the physician questions, and that the patient answers can display sensitivity to the implications of such questions that they impose. Another study found physicians who asked, "How are you?" questions did not index patient medical concerns in the same way that physicians who asked, "How are you feeling?" Furthermore, it appears that question design is implicated not only in the effectiveness of information gathering, but also in the management of the social relationship between doctor and patient. For example, if a doctor questions during routine history taking are designed to elicit answers from patients that confirm optimistic states of affairs. So the example given is part of family history taking. Doctor asks, "Is your father alive?" rather than "Is your father dead?" Okay, the American Animal Hospital Association has recommended that nutritional assessment be performed during every veterinary appointment with a dog or cat, and the curricular focus on nutrition and veterinary education is growing. Survey research on dog and cat owners' self-reported feeding practices showed that for over 17% of dogs and over 6% of cats, home-prepared foods were reported by clients to compromise at least 25% of the pet's diet. Detailed advice is also available on how to communicate effectively with clients when taking nutritional history, approaches for collecting dietary information, nutritional history forms that can be filled out by the client, and the benefits of beginning the interview with open-ended questions. So materials and methods. 61% of appointments were found to have segments of nutrition-based communication. There's a lot of information here. It's a long study, so I'm trying to narrow it down to what you guys need to know. 57% of appointments featuring 15 veterinarians featured the topic of nutrition initiated by the veterinarian asking the client about the patient's diet. Okay. There we go. All right. And then results. So identification of dietary question types. Let's see here. Four types of veterinary-initiated dietary questions were identified in 98 appointments and 99 questions. The most common type is what preface questions. So what kind of food is she on? That occurred in 76% of sequences. Yes or no interrogation questions like any food change, yes or no, were identified in 13%. Another yes and no declarative question, "You're still using this brand name, right?" or question mark. And other questions of similar type were identified in 10%. And the final category was question answer sequence was 1%, which is a alternative declarative question. So now, ... she's on this diet or not. Okay. Then when you look at the what preface initial diet questions, there were 85% that were considered simple, 15% were considered complex. So a simple what preface question was a standalone single question asking about the content of the patient's diet. What are you feeding him? Followed by the client response. Then you have yes or no interrogative appended. Do you know? Yes or no. Were treated as simple questions because they occasion client responses about diet content. The complex what preface questions, there were two types for those. The first form consisted of two what preface questions uttered by the veterinarian with no client response to the first question before the delivery of the second. So for example, what is the food? What are you feeding her? So they asked two questions in a row. The second form of complex questions was an initial what preface question connected by the conjunction and to a second question. So what are you feeding her and how much are you feeding her? Two questions in a row with an and. And these questions were uttered in a single turn before the client responded. All right. Of the 15 veterinarians, 11 female, 4 male, median time in practice 10 years, 13 worked in clinics that had at least 2 veterinarians. Of the 15 clinics in which the veterinarians practiced, 8 were in urban, 4 rural, 3 suburban. Of the 64 question answer sequences, 45% involved dogs, 55% cats. The type of appointment, 76% wellness, 24% problem. There were regularities with some variation in the wording of 64 simple what preface questions. 28% had what as a pronoun, like what are you feeding him? What does she eat? What is the regular diet? 6% had what as an adjective modifying the single noun, food. What food you have her on? What food are you feeding them? 66% contained what as an adjective modifying a noun phrase beginning with the kind or type. What kind of food are you giving them? What type of diet is she eating right now? Noun modifiers were occasionally used with the noun food, specifying patient species, so what kind of cat food, or the particular life stage, what kind of kitten food. The adjective regular was used once to modify diet. What's her regular diet? If the patients were referenced in questions, this was always done with pronouns, he, his, they, their, rather than proper names. Questions were constructed with various action verbs, like eat, feed, give, get, in the active voice, with either the pet as the agent, what's he eating, or the client as the agent, what are you feeding him. Action verb tenses typically were either the simple present tense, what do you feed her, or the present progressive tense, what kind of food is he eating. State of being verbs were also typically conjugated in the present state, what is her diet, although occasionally in the present perfect tense, what kind of food has she been on. Occurrence of a prepositional collocation formed by the verb is the preposition on, was most frequent in questions with what as the adjective modifying noun phrase. What kind of food is he on? Occasionally, questions with state of being verbs in the main clause were constructed with the client as the agent in a subordinate clause containing an action verb. What is the food that you started him on, or what is the food that you keep her on? So this is what I mean with this study. It's just they're just deconstructing the questions, and it's a bit, it's a lot. Let's see here. For the remaining 25 question answer sequences, the client reported 2 food items in 28%, 3 food items in 6%, 4 and 3%, 5 and 2%. For the 61% simple what preface question answer sequences, the client reported only a single food item the patient was consuming. 95% of sequences, the answer consists of a brand name only, or a sub-brand only, or brand name plus further sub-brand. Types of sub-brand information included the type of food, so like wet or canned, dry kibble, life stage like kitten, or targeted health like low calorie. Okay. Client answers most frequently occurred immediately after the veterinarian asked the question in 53% of cases. Closure of these question answer sequences happen as a result of the client's answer in 29% of cases, or the veterinarian's third turn response to the client's answer in 71%. 6% of sequences, the smooth production of question-answer adjacency pairs was disrupted by client struggles to produce the sought-after diet information. In 34% of sequences, more information about the previously mentioned dietary item or a new item was provided after completion of the client's initial answer. These expanded sequences happen in 2 ways. One involved veterinarians reacting briefly to clients' responses, which led to an elaboration. In 25% of sequences, veterinarians use so-called other repeats, like repetition of clients' prior answers, or minimal response tokens like okay, or yeah, uttered with continuing rather than with final intonation. And then finally, the 3 broad patterns of regularities and variations emerge with respect to diet-related questioning after the initial what preface question answer sequence. 50% of instances, veterinarians asked no further questions. In these instances, veterinarians switched either to a different line of diet history or a non-dietary topic. 30% of instances, veterinarians asked questions seeking clarification about the previously mentioned food item or items. 20% of instances, veterinarians inquired about other dietary items immediately or shortly after the initial what preface question answer sequence. Okay, discussion. In the present study, 61% of the total number of videotaped appointments available for analysis contain nutritional related discussions. In the remaining 39%, patient diet was not mentioned. Lose. The predominant vehicle by which veterinarians in the present study initiated the topic of patient diet was a simple what preface question. 89% simple what preface question answer sequence. The initial diet question elicited the reporting of one or two food items, and only 5 of the 64, which is 8% of sequences, included mentioning either treats or human food. Moreover, when the entire trajectories of simple what preface questions across the veterinary visits were systematically examined, in 75% instances, veterinarians failed to subsequently solicit information about additional food items. Bad vets. The low frequency in which human food, which is 8%, and treats, which is 8%, were mentioned in the client response are concerning in the context of previous empirical research. In a large survey study, pet owners reported that 13% of cats and 30% of dogs were given non-commercial food as part of their main diet, and 21% of cats and 41% of dogs were fed at least one commercial treat. Bone or raw foods were fed as part of the main meal of 9.6% of cats and 16.2% of dogs. The American Animal Hospital Association Nutritional Assessment Guidelines emphasize that diet history taking during nutritional screening should gather information not only about commercial main diets, but also about chew toys, medications, the foods used to administer those medications, nutritional supplements, snacks, table foods, treats, unconventional diets, including homemade, raw, vegan, or vegetarian. Previous research in dogs found that compared with owners of normal weight dogs, owners of overweight or obese dogs tend to feed them more kitchen scraps, snacks, or treats. Open-ended questions have been defined in the field of medical communication as those that set a topic while encouraging expansion by allowing the recipient considerable freedom to answer. Closed-ended questions are more directive or restrictive in how the person should answer. In human medicine, the recommendation that open-ended questions be used with patients as a precursor to closed-ended has been strongly promoted and is increasingly reflected in clinical communication training. So examples is, a common one is open-ended would be, is there any vomiting? Versus, there's no vomiting, right? Those are the differences there. One alternative approach to diet history taking, drawing on the Calgary Cambridge Observational Guide, advocates a co-creation of a patient's history through a funnel approach. The practitioner asks the client questions of different designs in a serial fashion, moving from one open-ended request for information to close-ended, seeking particular bits of information. This approach facilitates engagement of the client's perspective from the beginning of the history-taking activity and can gather in a stepwise fashion critical information to guide investigation and treatment. This can include social, lifestyle-related information. With a patient presenting with a poor appetite, a veterinarian might start by inviting the client, "Tell me about a day in the life of you and your pet." Move on to ask, "Would you tell me about your pet's normal eating habits?" And then use more detailed questions. Describe your pet's eating habits over the past 3 days. And finally, these findings dovetailed with previous recommendations that veterinarians support client information sharing by pausing, avoiding intervening or interrupting clients, and using eye gaze, head nodding, and minimal prompts, or go on, to encourage the client to keep talking. In a study of human diet history taking, it would suggest that patients may omit meal descriptions from foods that they feel sensitive about, which may be solicited through further questions. This may also be necessary in veterinary medicine. That's it. I mean, again, this could have been summarized a bit more. It could have been a much more simple study and still, hit a home run. But it is very important. We have to know how to ask questions. I mean, that is literally the majority of your thought process as a veterinarian is getting the historic information. And you only get that information through good questions. And you also want to do it in an efficient way, but you don't want to cut corners. So, very good. I'm going to stop there because this video is already long. And we'll see you again in the next one. Take care.